Hypertensive emergency with brainstem edema. Posterior reversible encephalopathy syndrome or reversible posterior leukoencephalopathy syndrome has been described in a number of medical conditions, with hypertensive encephalopathy, eclampsia, and the use of cytotoxic and immunosuppressant drugs being the most common. Prompt recognition and treatment are important in preventing the permanent damage that can occur in this otherwise typically reversible condition. The white matter edema is typically most prominent in both posterior cerebral hemispheres. However, the calcarine and paramedian parts of the occipital lobe are usually spared, helping to distinguish this condition from bilateral posterior cerebral infarctions. Relative sparing of the cortical gray matter in RPLS also distinguishes this from posterior cerebral artery infarction. Involvement of the cerebellum and brainstem is common. Isolated or predominant posterior fossa lesions, while uncommon, are increasingly described, sometimes called hypertensive brainstem encephalopathy or central variant. This case shows these changes. This patient presented with acute hypertensive crisis with underlying renal failure. On clinical examination, diffuse weakness was noted. An emergent MRI brain showed brainstem edema. She underwent emergent dialysis with marked improvement.